For 2019 is Mental Health Promotion and Suicide Prevention, and celebrates awareness in an empathetic way and taking actions that will bring about lasting change. Here at home, the Tara Hospital, under the hashtag You Matter, is conducting a 6.7 kilometer fun walk this Friday in an effort to highlight this plight. Gigi Lama is a very well-known musician and a rap artist, and she has also highlighted her challenges with depression openly. So she joins us now on the line. She's one of the organizers. Gigi, thank you so much for talking to us this morning.
Thank you so much for having me.
Tell us about this walk. What is it all about?
So the current walk tomorrow, it takes place tomorrow. 8 a.m. is the registration, and 10 a.m. we begin the walk. It's 6.7 kilometers, and it's basically out and then back into Tara Hospital. It's going to be really cool because we're going to have a whole lot of people from various organizations around, and we're just going to be speaking about everything mental health, how people can get help, if you're family to somebody who struggles with some kind of mental health issue, how you go about it, coping mechanisms, and it's really just like a very informative morning around that. And we're excited because it is the first of its kind, and a lot of people are coming in. I mean, my whole family's coming through, people young and old are coming through, so we're really excited about that.
You've previously come out yourself to address your multiple followers about your plight, in terms of depression. Tell us a bit about this.
So I think I realized in 2019 that it wasn't a very popular topic. I think for one, there was a little bit of backlash coming from people who I still, deem, I wouldn't say ignorant, but who don't know much about the matter, and that it is a growing phenomena when, it comes to young people in 2019 growing up in the South African context. Whether you're influenced by social media or whatever other things you go through, and it's not really a very popular, topic. I think in the African context, for most of the time, you'll hear all sorts of myths around, I was told I was bewitched. I was told that I was crazy, and a whole lot of other labels, sort of like stuck to me. But I think it was just deciding that I was going to go against the grain. I'm as much as I'm the cool kid that every other child looks up to, there is something called depression, and anyone can get it. And it's not, you're not crazy. You're not crazy. It's a chemical imbalance. It is something that can be dealt with very easily. But it's still a very, touchy conversation, especially when it comes to the South African context. But I do believe that with a lot of these awareness campaigns, eventually people will get the grasp of it, and people will begin to educate themselves and get more involved in things like that.
I like that you touching on the fact that you are perceived as the cool kid, because just like gender-based violence, there's this perception that there's a certain type of woman, especially if you're accomplished, that cannot be abused by a man. How have you been able to just look away from all this backlash and decide, I am going to work on highlighting mental health?
I think when you realize that your purpose is bigger than your paycheck, your purpose is bigger than your talent, your purpose is bigger than your career, you begin to really want to make a change. And I think it doesn't come with anyone. It's easy to just carry on with life and believe that it's easier to fit in. But, just with coming out and hearing about a whole lot of other people, I think that just definitely gave me a bigger push, So I had young people DMing me on Instagram, Facebook, social media as a whole, saying, Gigi, I think I'm depressed. I don't know what to do. Thank you for coming out. Where can I go to? How do I cope with stuff like that? And I think for me, that is the small niche audience that I have chosen to deal with and to interact with, not so much people who are negative around it. And I must say, it's something that's growing, and it's absolutely amazing to see so many young people taking control of their lives and really trying to better themselves and even better their friends, just conversations around, my friend is really going through a tough time. She's always sad. She's very isolated. What can I do to support her? So I think for me, I'm really focusing on those people, and I'm hoping that I can make an impact in their lives.
Gigi, the theme this year says that instead of just being empathetic, people should also find activities that can help bring about lasting change. What sort of conversations are you going to be having at the Tara Walk?
So we're going to be having conversations, obviously, around where people can get help, really making therapy look cool again, whether it's therapy in the household with your friends and family or professional help, what an antidepressant even looks like, who you go to, the differences between a psychologist, a psychiatrist, different organizations that you can reach out to. We have lots of people who are affected by these things, but don't necessarily afford some of the services, how they can go around that and receive the help that they need. So it's going to be really cool. There's going to be food. I'm excited about the food, and I'm excited about all the different people that are going to be there, just really, really making an impact. So shout out to the department, government for coming on board. It's an amazing thing, and I believe that once its leaders acknowledge and they take part in something, the plight to its success becomes easier.
Yeah, food is always a good reason to come through, isn't it? Gigi, thank you so much for talking to us today,
Thank you so much.
World Mental Health Day.